here. This meeting will come to order. This is a regular session of the Bloomington Common Council for Wednesday, April 15th, 2020. Will the clerk please call the roll?
Yes, Councilmember Rallo. Skip him. Councilmember Scamboluri.
Here.
Rosenbarger. Sims.
Here.
Mullen.
Here.
Piedmont Smith.
Here.
Flaherty. Smith.
Here.
Sandberg.
Here.
And I'm going to come back to, nope, I think we lost Councilmember Rallo, but he was here. Not here.
Good.
There you are.
Well, we have a quorum. And just for the record, per executive orders issued by the governor, this meeting is being conducted electronically. Public may access the meeting using zoom.us at room number 712-583-082. Here is a summation of the agenda. We will hear reports from council members. We will hear a special report from Penny Caudle of the County Health Department. We will then hear reports from the mayor and city offices, council committees, and then the public. We'll hear appointments to boards and commissions, and then we'll handle 2 items of legislation for first reading and resolutions. Ordinance 2006 to repeal and replace the official zoning map within Title 20 of the Bloomington Municipal Code entitled Unified Development Ordinance, and Ordinance 2007 to amend Title 20 of the Bloomington Municipal Code entitled Unified Development Ordinance. Note on these two, this meeting constitutes the first regular meeting of the council after the ordinances were certified to the council by the Plan Commission. Under state law, Indiana Code Section 3674-600, and so on, the council may act on the proposals tonight. The council intends to consider the proposals for final action at this meeting, which is why legislation for second reading resolutions will follow first readings, and they will be ordinances 2006 and 2007. We will have up to 25 minutes for additional public comment. We will discuss matters of the council schedule, and then we will adjourn, followed immediately by a committee of the whole to take up Ordinance 2009 to amend Title II of the Bloomington Municipal Code entitled Administration and Personnel, and to grant authority to act in accordance with declared disaster emergencies regarding amending Bloomington Municipal Code 2.22.030 entitled Employee Policies and complying with the state of Indiana's declaration of disaster emergency under Indiana Code Section 1014.3.12. With that, we will go first to reports from council members. I'll start with the members as they appear on my screen with Councilmember Sandberg.
No report, thank you.
Thank you. Councilmember Scamboluri.
No report, thank you.
Councilmember Smith.
No report, thank you.
Councilmember Piedmont Smith.
No report, thank you.
Councilmember Rallo.
I have none, thank you.
Councilmember Sims.
No report, thank you.
Councilmember Rosenbarger.
No report, thanks.
Councilmember Flaherty.
No report, thanks.
All right, I have no report either, so we will go straight to a report from Penny Caudle, the director of the Monroe County Health Department. Ms. Caudle, are you there? Can we see your smiling face?
I am here. Thank you very much for having me. I appreciate it. Just a few things to kind of update you. The state health department's dashboard has been revised and updated to add more detail and information. And it is now updated at noon instead of 10 a.m. So because of the added information. So just a few things that one might find on that website. Now it not only tells you the number of tests the State Department of Health has done, but it will tell you the number of new cases, the total number of cases, deaths are reported, the new deaths for the day, the total number of deaths, total number of tests done. And that's a big change because with communicable diseases, positive test results are reportable, but not negative tests. So last week, Dr. Box, our state health commissioner, ordered that all COVID-19 tests were reportable, whether the results were negative or positive. So that's a big change and will really give us a better picture about what's going on in terms of testing. Testing is increasing. The state has started doing some drive-through testing. They did a drive-through in Maryville earlier this week, last weekend, and I think the first of this week. That seemed to go very well. They have a couple planned for Southern Indiana, and then I think as those occur, and they'll be expanding those, is what I understand. So today's report, Monroe County had 95 cases. We have unfortunately experienced 2 deaths so far, and those have come in the past week. So we hope that we can prevent those. I think one thing that's very important is that we continue to do the things that are in place, the social distancing, wearing a face covering if you're out in public and you can't maintain that social distance, staying home as much as you can, only going out for essential services, and doing that singularly, going alone as opposed to a group or taking your whole family. Go as few people as possible. I know if you're a single parent, you may have to go with somebody, but if you can help each other out and not do that in groups, that's helpful. And that's what is really helping us kind of maintain our numbers and keep them as low as they possibly can be. The fight isn't over here yet, so we need to kind of stay the course and continue to do those things. There's also information on here. I know that there were questions last time about the hospital capacity. So this is for the state, but it does look at ICU beds and ventilator usage. And so right now the state is in pretty good shape as far as that goes, but that's also included on that website. So it is good information, lots more information than what's been on there before, including the demographic information. So I think that they'll continue to add more information to that as we go, but that's why it's not updated now until noon as opposed to 10 a.m. Again, we talked about, I think before, face coverings and people making those and donating them, and the county, EMA and the health department and the hospital have been working together to collect those. We have given out well over 700 to over 12 agencies, mostly shelters and long-term care facilities, group homes, those type of facilities. We want to thank people for making those donations. We still need them. And I know that there are other groups who are doing similar things, that are making those face coverings, cloth masks, and then distributing those. And that's a wonderful community outreach, and we appreciate everybody who's involved in that. So a big thank you for those. The other thing that I wanted to say is that we are working very hard. I know the city is working hard, and our shelter folks are working hard, and the county is involved as well in terms of how we can protect our populations, our residents who are experiencing homelessness. So we're working very hard on that. We are starting kind of a peer educator training so that we can get people who are experiencing homelessness themselves and can educate their friends and others that they encounter on a daily basis about social distancing and what that may look like, can help them get a bandana or something to use as a face covering, and just those kinds of things, what good hand washing looks like. We're looking at handing out some bandanas and some hand sanitizer to those folks. So we're working on those things and getting that started. That's kind of where we are. Oh, I know one other thing, that in terms of the hospital rate for the state, right now the hospital rate for COVID-19 patients is about 12.3 per 100,000 people. So some of you I know like those statistics, and that's just something else that I was provided with this week. So that's my report in a nutshell.
Thank you, Ms. Cottle. Are there questions for Ms. Cottle and her report? Councilmember Varallo.
Thank you, Ms. Cottle. If you were a Bloomington, Monroe County resident, you'd like to be tested. How does one go about it?
You go about it, the best way is to use that virtual app that IU Health has, and it will walk you through a screening process. And then if testing is advised, you have symptoms that are consistent with COVID-19, then they will tell you where you can go to get tested. So there is some drive-through testing, but you do need to have that order and kind of a ticket to get that test done. So use the virtual hub. If you have a private provider, you can ask them if you're seeing them, if they can provide testing for you. It is opening up a little bit now. You do need to have symptoms, but testing is becoming more available.
Thank you.
Councilmember Piedmont Smith.
Yes, I didn't quite understand the 12.3 per 100,000 people statistic. What is that?
Sure. So when they look at the associated hospitalization, so the overall rate of people with COVID-19, so hospitalizations that are related to COVID-19, there is a rate of about 12.3 people per 100,000 people. It's just looking at a rate as opposed to an actual number of people. So for every 100,000 people, there are 12 that are in the hospital related to COVID-19.
For every 100,000 people who have COVID-19, only 12
hospitalized. Well, it's 12.3 per 100,000 people.
Hoosiers.
So, yes.
Counting all people, healthy and not healthy. The rate is 12.3 per 100,000. That's the number in the hospital for COVID-19.
Overall cumulative COVID-19 associated hospitalization rate, yes, 12.3 per 100,000.
Other questions for Ms. Caudill? Councilmember Scamboluri?
Question two.
So
Councilmember Scamboluri.
just to make sure I'm understanding this, out of 100,000 population, there are 12.3 people hospitalized with COVID-19. The actual infection rate, though, will be higher, correct?
Yes, very much. That's just looking at hospitalization rates.
Do we know the infection rate or no? Out of 100,000?
No, I don't think we really do because everyone hasn't, because of the testing capacity that we have.
Okay, thank you very much.
Councilmember Smith.
Thank you, Ms. Caudill. I'm wondering if there's any news on serological testing where someone who thinks they may have had COVID-19 could get tested and allay some of their fears.
Right. So the antibody testing, I think, is what you're talking about. That's certainly not ready yet, but I think it will be coming down the pike. And it will certainly be a useful tool for us in many ways to identify, one, if people have been infected, can they go back to work? But the bigger picture in terms of how long we maintain immunity and those kinds of things will be very important to us going down the line.
Thank you.
Hopefully soon, but I don't have a date.
Yeah, appreciate it.
Further questions from council members? Councilmember Sims. If you can unmute Councilmember Sims, please.
Can't hear you, Jim.
Okay, how about now?
Yeah, good. Please go
Okay,
ahead.
good. Thank you. I had the pleasure of listening to Ms. Caudill give a presentation the other day, and I think there was an answer to one particular question that maybe she can expound on, maybe not, but maybe it'll be an interest of everyone else. And that is, Ms. Caudill, with the burgeoning rate, the disparate rate of how it's affecting African Americans across the country, how are we looking in Indiana, and more specifically, Bloomington, Monroe County?
Yeah, I don't have some specifics in terms of Monroe County at the moment. I expect we will have those, but certainly we are seeing disparities and African-American population being affected more in terms of more serious complications, and that may fall, we see with social determinants of health, greater proportion sometimes of underlying health conditions that may be playing a role in that. Certainly something that we want to watch and address. I think it will help us as we look at how we can address those issues and concerns going forward.
Thank you. Oh, go ahead. I'm sorry.
I was just going to say, I'm not sure that I completely answered your question, and I lost the website, or I might be able to give you some of the demographic data that was on there if I can pull it back up.
Well, I know things change so fast, and that's another issue I think that's going to take further study, I think, on you guys' part or the state's part. And since things move so fast, I thought maybe we'd heard something in the last 24 hours since I last heard from you.
Yeah.
Okay, thank you.
You're welcome.
Thank you. Any further questions from members? Seeing none, Ms. Cottle, thank you so much for coming by to give us an update. We really appreciate it. We're going to be inviting you until the emergency is over. So, you know, we would love to have you every time we meet.
Right. Thank you very much for having me. I appreciate the opportunity.
Same here. Thank you. We now go to reports from the mayor and city offices, and I want to introduce the mayor by saying that on behalf of the council, we wish your wife, Dawn, a speedy recovery.
Thank you. Can y'all hear me okay?
Yes.
Yes.
Go ahead.
Thank you very much. Let me just say thanks to Penny Cottle, too. We've been working closely. She's a professional, and her group, her team, and herself have been so committed and working so hard on this, and we appreciate their expertise and their dedication every day in this. She's been running hard for a long time. We really appreciate that. I'm pleased to be with you again. Nice to see you virtually. You've heard me say we're in a marathon that starts with a sprint. I think maybe I would say we're kind of coming to the end of a sprint and ready to settle into a marathon about now. As you heard from Ms. Cottle, the physical distancing, I call it physical distancing because we don't have to be socially distant. We just need to be physically distant. But that physical distancing is so important, staying at home, except for essential work and activities that you heard her talk about, is so important. We know it's hard. As your mayor, I know it's changed virtually everyone in our city. I know that every city employee, without exception, is doing their job differently from how they did it 2 months ago. Every city employee. There is no city employee that is working the same way today that they did 2 months ago. And that's true for everybody in our community. Everybody's life is different today than it was 2 months ago. It's important to just kind of say, look, if you're out there and you're lonely, if you're feeling isolated, if you're feeling down, we understand that. This is a challenging time. We want to make sure you reach out to people and to each other. If you're worried, if you're bored, if you feel stuck in your home or isolated, please don't be socially distant. Be connected with people. Stay physically distant with people, affirming that over and over and over again. But this is a tough time, and we are, I think, settling into a marathon where we're going to be in this different place for some time, and we need to take care of each other. I do want to, again, thank our workforce, our healthcare workers, the service sector that's working so hard to help everybody else continue to get groceries and pharmaceuticals and other necessary items, and of course our government employees who are hard at it every day, and we so appreciate that. The surge, we don't know exactly the surge, but it's probably still coming in terms of the healthcare system. But as Ms. Cottle said, the work that we've all done together has really helped protect the healthcare system. So I will just briefly comment. Thank you so much for your comments about Dawn. She's 5 days in the hospital. I'll report. You all know we let that out she went in Saturday. She's 14 days into her symptoms. It's a nasty, brutal infection. It's tough. And she's working hard with great support from people in the IU health system. And we really appreciate the support that she gets, like everyone else in the hospital and in the system. And, there's no stigma to having this disease. This is a disease that you get, and you need to get it taken care of. And thank goodness we have the kind of healthcare system and access to it that we do. And I know she appreciates your support, and we'll keep people informed about that as appropriate. And if she's watching, hello. It is hard not to get to,
hi, Dawn.
You know, not to get to be in the room with her. That's really tough. But let me just mention a few things, and then I'm going to hand it over to Alex and Beverly to update on the work groups. The continuity of city government team is active. They are actually kind of moving into a weekly rhythm now. They began at three meetings a week, really doing the sprint, trying to make sure we adjusted all we could and responded all we could. They're now settling into a weekly meeting to assure that we're keeping on top of this, can give you reports like our firefighter that was our first COVID positive is back at work. That's terrific. Also, all of the individuals who were connected with that firefighter in any way have been either 14 days with no symptoms or they've been tested. We've had a couple tested negative. So it appears that incident did not expand. At least it looks like that right now. Our second employee from Parks is recovering. I'm glad we haven't had a third report yet, but we'll keep monitoring all that. Masks have all been delivered. You heard Ms. Cottle reference that. The Alson Jukebox has become kind of a mask factory of the volunteer work, quilters and others who are doing incredible things. I think from what I understand from Jason Moore, they've increased production from about 200 a day to almost 900 masks a day from this volunteer army, which is fantastic. We've delivered masks to all city staff. Additional employee changes are underway. We've added 40 new employees to get email accounts that they didn't have before, so they can be better informed in these days of distancing. We have moved a holiday. Steve, I didn't hear the very beginning. I don't know if you mentioned that, but we, because the governor moved the election day from May 5th to June 2nd, the city is shifting our election day holiday from May 5th to June 2nd, consistent with the state's emergency order. And we also have decided, for a variety of reasons, partly because of that holiday movement, partly, frankly, just because our employees are kicking it in and killing it and working so hard, we just decided to add another 8-hour day benefit time to every employee that they can use May 5th if they want, or any time after that this year. We just awarded an extra day of holiday to thank them for all that they're doing. I can report on the Families First Coronavirus Relief Act, which we've mentioned here before. We have had up to date 48 employees seek coverage for that, which is either a 2-week paid leave or a 12-week 2/3 pay leave for childcare, split mostly on the 2-week, though a substantial number on the 12-week as well. So that's 7% of our workforce, and they're not all eligible to all of that, who have sought that, and we appreciate the chance to offer that, and people are taking advantage of that over the next couple weeks and few weeks. You know, we're continuing our city work from public safety to sanitation to construction projects. You've seen, I'm sure, the list of construction projects that are underway. Farmers Market is underway. I understand that they're tailoring that, learning as we go. I understand they're going to be back up to a goal of about 475 attendees for this coming week. So back substantial growth from this past week. And I am really pleased to let you know that in the midst of all this, tomorrow, there will be a virtual ribbon cutting of the Switchyard Park affordable apartments, Switchyard Park apartments, 8 new apartments that you may have seen there going up. We donated the land, and working with SciHo and others with financial support. Those are 8 new affordable units that will be virtually ribbon cut tomorrow. So look forward to that. I'm so proud of what people are doing. I appreciate all your support. I am also just need to personally thank my staff who have made it possible for me to keep my focus in many ways on my family as I need to, even from a distance, while continuing to try to do what I can and should as mayor during this time. And hopefully that'll all shift for our own family pretty soon, we hope. But I want to thank them individually. Not individually. I want to thank each of them for their dedication. They're working so hard. So I'm not going to summarize, but you'll hear from, let's do Beverly, Callender, Anderson first, and then Alex on the 2 work groups. I'm so pleased with what they're doing to help support our social safety net, very important housing progress, childcare progress, others, and as well, I know you'll hear from Alex, the incredible speed and work on the economic recovery work that we're doing. So I'll maybe we let them speak and then we can all take questions at the end if that works for you. But thank you so much for giving me the time. Thank you. So Beverly, I think you're up.
Yep. Thank you, Mayor. And thank you, Councilmember Volan. So I have been working with these social services working group. And I think last week when I reported, we had spoken to a number of childcare providers and shelter providers and started to assemble their priorities. Some of those have moved forward, those things that we can resource and sort of get some solutions to quickly. We're trying to do that. We have since talked to food providers and persons who are working in areas where health and safety are important. And so looking at mental health issues, things that would cause a public health issues in the community, and other behavioral health kind of things. So that's what we've done that, had a group of about 30 people on a call today. And so that was really interesting. And there were some really emerging themes around that. I want to talk a little bit more, though, about the isolation shelter. If you saw the paper yesterday, you know that the Travel Lodge has been identified and secured as an isolation shelter for people who are experiencing homelessness, who are COVID-19 positive, presumed positive, awaiting testing, or have been required to maintain isolation but have no other place to do it. And so we have been working really closely with New Hope, Wheeler, Shalom, the county, BPD, and the state, pulling that together. The city agreed to be the fiscal agent for that shelter. There's a grant for running that. So we'll be the fiscal agent for that. Unfortunately, they had their first guest last night. It was a gentleman who was presumed positive awaiting testing. His test did come back negative. And so he was leaving today, I believe, either today or tomorrow. But they isolated him while he was awaiting testing. Now that his test has come back negative, he'll be returning to shelter. The state has been really great with us. They have offered support in the areas of putting together security teams and emergency plans. And so the police department and the fire department both have been working closely with us on that. It's really been a good relationship so far. I said to the group the other day, it's going to be really great, and I hope we never have to use it. But we have had to use it once, and if that's all we have to do, that would be a good thing. Our team has also, or my CFRD team, has been working with the Fabric Mask Project, and I just wanted to piggyback on what the mayor and Penny said, and they have distributed over 6,000 masks in the community so far, and so that really proud of that. I mean, and they're still going. They're really going to try to get as many out as we can. We gave some to our DROs and other police officers. So if they are seeing people out and about, whether they're in parks or walking along the street and they don't have them, if they want to have them, they can distribute it to them as well. So those are some of the things that we've been working on. And I guess I can take questions after Alex or.
Yes, please. Thank you. Mr. Crowley.
Thanks, Beverly. So Alex Crowley, Director of Economic Sustainable Development.
Turn it up a little bit, Alex. A little bit.
Hear me okay? Is that okay?
It's a little bit louder.
Okay. Let me see what I can do here.
It's a fancy setup you have there.
It is a fancy setup. How's that?
That's better.
Okay.
There you go. Thank you.
I'm going to share my screen here. I need Stephen's help to share my screen, if you would. Okay.
Stephen, if you would.
Everybody see that okay?
Mm-hmm. Mm-hmm. Yes.
Yes. Great.
Yes.
So I'm going to give you a quick update on the Rapid Response Fund, and just want to kind of fly through this quickly, and then we can open it up to questions. I will share this document at the end with you, and certainly feel free to ask questions because I'll go pretty fast. So the first thing I want to remind you is we've got a really great team working on this. This is the Economic Stabilization and Recovery Working Group. And just to remind you who's on that, they've been doing unbelievable amounts of work. And it's really very impressive to see this team move as fast as they have. So this is the team. So the next thing I want to talk to you about is we've gotten a whole bunch of applications, and I'll give you some data on that, but I just want to remind you of what the application review process is. So an application comes in, it is scored first as a financial review score by a subset of reviewers that are lenders, and they are going through that application. Concurrently, it's also being scored for impact review. And by that, we mean that the organization, whether it's a nonprofit or for-profit, is being looked at in terms of its impact in the community. So both of those are happening in parallel process. And because the second one, the impact review, is much more subjective than the financial review, which is much more objective based on the information that's being submitted on the application, we have up to five reviewers looking at each application coming across. Both of those yield a score. All of that is compiled, and then it is issued to the city as part of a recommendation sheet. So the compilation is brought together. The city ultimately makes the final recommendation and final decision. And then if it is an approved loan, it is sent through an internal process at the city, which has various different controls. And if it is rejected, then we will issue a rejection notification, which will then trigger an appeals process. And frankly, we are working through the appeal process right now to understand exactly what that'll look like. But essentially, that's how this all works. In the approval process, there is ultimately a loan agreement and other documentation, and we're building that up and getting ready to issue some of that shortly. In the case that anybody has an issue, if you look at the bottom with the application itself, there are essentially two different layers of help desk. One is more of a technical help desk, which is being manned by the city and also by CDFI Friendly Bloomington. And to remind you, CDFI Friendly Bloomington helped build the platform. So they have a good sense. Brian Payne has a good sense of how it works, but also at the city, we can help answer questions. And then if there's more of a general question about how to fill it out, then we send those over to the SBDC and they can help with that. So in terms of application volume, what you'll see is in this graph is the volumes from April 10th, which is the first 24-hour period. And we tend to track these from 9:30 in the morning, at 9:30 in the morning. So these are all 9:30 in the morning numbers. So within the first 24 hours, we had 66 applications that were started, which is the light blue. We had 5 that had been completed, which is the dark blue. And then you'll see in the last date, you'll see an orange in review, which means that's what's being looked at by those two review committees. So you'll see here the trend. There were a lot of, there's a pretty aggressive increase in the number of applications that were started. That increase also played out in terms of those that were completed, but frankly, we're looking at a completion rate starting to tail off a little bit, and we're trying to figure out what's going on with that, and I can talk about that a little later. So from April 10th through April 15th, you'll see that growth from 66 to 138 totally started. 36 were completed as of this morning, and 32 are in progress in terms of the review progress right now. This is a quick overview of nonprofit versus for-profit applicants. So you'll see that the nonprofit, which is in red, is about 22% of the total, and the for-profit is about 78% of the total. We're looking at ethnicity of the applicant, and you'll see here heavily skewed to white applicants. one African-American applicant, 2 Asian and or Pacific Islander, and then 3 Hispanic or other. And the reason those 2 are grouped together is because there was a little bit of funkiness, which we'll clear out of the process, where exactly designating that was less than clear. So I've grouped those together. In terms of the gender of the applicants, this is again, all of them being, these are the 32 that are currently being reviewed, as was the last slide. 17 of them are by male applicants, 11 are by female, and 4 other, and by other you'll see at the bottom. So we have genderqueer and binary at 2 of those. One of them had preferred not to answer, and one had just been left blank. So the issues and the next steps that we're tackling right now, other than building the actual process, which is literally happening as we speak, and for generation of loan agreements. But the general process challenges that we're seeing is, why is there a drop-off between in progress and submitted applications? Does it have to do with the complexity of the application process? Is there something else going on? We need to get underneath that, and we intend to do that in the next days. Number 2, what improvements can be made to the applications and to the review process? So one of the things we're doing is we're having an 8 a.m. Session tomorrow morning with all of the reviewers that can make it to give us feedback about the review process, and anything that we can change and improve on that, we'll implement as quickly as possible to address future applications. The next point is, how do we reach more underserved businesses via communications? And so we're going to dig into that and try to figure that out and address that as quickly as possible. And then also, generally, we're starting to see we're getting anecdotal feedback about the CARES Act elements of that hitting. And so we want to make sure we understand how this loan fund is fitting in with the CARES Act needs. Next steps. So we're going to complete the review of the first 32 applications and then issue loans as approved. That should happen here in the next 24 hours. And then iron out any process challenges that we've uncovered as either part of the application process or the reviewing process. And then, not unimportantly, because while we're all focused very much on this rapid response fund loan, we also want to start to pivot our attention to mid-range and longer range planning, which has already started, but we've been so in the weeds on this that we're basically, we need to do that in earnest. So I'm going to stop sharing my screen here, and that's it.
I want to thank the officers for their presentations. Are there questions from council members for Mayor Hamilton or Department Heads Calendar, Anderson, or Crowley? Councilmember Rello?
One for Mr. Crowley. I wondered about, you say there are multiple reviewers for these applications. Is an application seen by different eyes? In other words, is there an objective measure, or how do you prevent that, subjectivity?
So we have the reviewers. So there are 2 sets of reviewers. One is a financial reviewer, one is an impact reviewer. In both cases, we have given them and built into the system a matrix, essentially a very kind of black and white matrix on how to judge the application. So in the case of the financial one, it's much more quantitative. It's about what is the data that's being submitted on the application. Follow this matrix. It's very quantitative. So that's why we were comfortable doing a single reviewer on that. On the impact reviewer, it's admittedly much more subjective, asking questions about, a variety of different, things, for example, like, what is the impact of this organization in the community, right? Which, and as judged by economic or cultural. And so it's very subjective. And so we are using the 5 reviewer process on that to isolate the Russian judge problem and let ourselves have a little bit more of an averaging that can help to avoid, the subjective skew that might come otherwise.
Great.
Councilmember Piedmont Smith.
Yes, I wanted to ask about the BUEA funding. Is Now, the process that you described, Mr. Crowley, was that just for the loan program through the food and beverage tax dollars, or is that same process being used also for the BUEA funding?
So it's being used for both, with the exception of some BUEA funding that was set aside for grants specifically, which are kind of longer term grants that will be managed under a separate process. But the majority of the BUEA money and the food and beverage money are going to be treated the same way. And in fact, at the end of the process, it falls to city staff to put an approved loan through a series of questions that determine whether it's eligible for food and beverage. If not, then is it eligible for BUEA? And that's a smaller amount. So we want to start with a larger amount. And then if it's not eligible for that, and that, then we are having discussions right now about what other capital sources might become available. But the sequencing and the decision-making will be happening at the city staff level for those two.
Further questions for city staff from council members? Councilmember Flaherty?
Yeah, for Ms. Conger-Anderson, thank you for the update. And I'd heard some of those details about the Regional Isolation Center and the grant that was awarded there. I was wondering if you could speak to sheltering needs in the community generally right now. I know part of your prior updates to us had been about the challenges with physical distancing in our shelters in town and kind of capacity in that regard. And I have know folks who've been working with a group sort of loosely called Hotels for Homeless that have been sort of augmenting the sheltering capacity that we have in the city through our great nonprofit organizations that have been looking at that. And sort of from the last report, I gathered that Wheeler had expanded some and Friends Place had kind of moved to the temporary shelter on Hillside. I was wondering, are we still facing capacity issues for sheltering at safe physical distances in Bloomington? How are the sheltering organizations and nonprofits feeling about that? And are we looking at anticipated increases even as a result of the economic fallout of this health crisis, for example? So if you could just kind of speak to that issue, I would appreciate it.
Sure. So Wheeler and Friends Place both are good right now. With the move to the other building at Wheeler, they were able to spread out. They were hiring some more staff, but even as they moved people over to the other building, they were able to use their existing staff and maintain a safe distance in both locations. They're right together. The same with a Friend's Place moving to the Hillside shelter. That gave them the room that they needed. We've not talked about, and I'm sorry, and I'll also bring New Hope into it. I think New Hope had a couple of families that needed to be isolated, and they were able to get hotel rooms for them. And so that worked out for them. We've not talked about anticipated needs in light of COVID. And that's something we'll probably be talking about later when we see more what the trends are coming down the line. But we haven't talked about that so far. But right now, both Wheeler and Friends Place feel like they're in a good place with the guests that they have now. Yeah.
Other shelters as well in town?
I'm sorry?
The other shelters in town as well also feel
yes,
they have adequate capacity.
Mm-hmm.
Okay, thank you.
Now, I will say I have not worked with, I think what you said was hotels for the homeless or housing for the homeless. Mm-hmm. I've not worked with that group at all.
Mm-hmm.
So.
Thank you.
Mm-hmm.
Further questions from members to department heads? Going once, Councilmember Sims. Councilmember Sims, go ahead.
Hi, thank you. I need a third arm. This is for Mr. Crowley, if I may. Is he there? Can you hear me?
Yep. Yes.
Okay. On your graphs, and I think, and I didn't get this exact, I might not have caught it all, but we've started 130 plus applications. 36 were completed and 32 are in review. Is that about right? And I guess my question is there a reason for the difference between those numbers in lieu of the urgency of the need, or is this a timing thing? And I guess my second part will go along with that. I know you've changed the view to mid-range to longer range planning. is there still room for short and very short-term needs? Will people still be able to try to take advantage of that?
So yeah, so in order of those two questions, the first one was the difference between 100. So as of this morning, there were 138 applications that had been started, 36 had been completed, and 32 were in review. So let me talk about the differences between those numbers. We believe that there's probably some number of the 138 that were started out of curiosity, and people just want to check it out. We also are looking at whether or not the process itself is onerous, and is that depressing the number of people who make it through to the other end. And now you obviously have to balance that out with the the responsibility that all of us have in terms of being fiscally responsible with public monies. And so that is a balancing act that we need to strike a good balance with. The difference between the 36 that are currently completed and the 32 was just a quick timing difference. We ended up sealing the first 32 into a initial group that we would send through as a group of applications, in part to test the system. And while we were doing that and had set them aside, 4 others came in. So that's the difference between the 36 and the 32. In terms of your second question, which had to do with the difference between short-term needs and longer, mid-range and longer term, we are absolutely focused on short-term right now. That's where the fire is, and we are not diverting our attention too much from that. We need to get this process ironed out. There are definitely some challenges. There's still some problems with it. We need to figure out what those are and make sure that we clear those. And we understand that while some money is coming in from federal government and there might be some more on the horizon, there's still a lot of people who are being left out and or not pursuing that thoroughly, or the timing of it is different than their need. And so this funding is focused on the short-term need on bridge loans. And so we want to make this as thorough coverage as we can. And then, sort of make sure that continues while we do start to think about other projects which have longer term views.
Okay, thank you. If I still have the opportunity, I'd really like to say thank you, Mr. Crowley and your team, as well as Ms. Calendar Anderson and her team. You guys are working very, very hard, and we do appreciate those efforts. And as we move forward, as it starts to flesh itself out under you guys' purview with regard to the process and maybe the application, you mentioned there could be something onerous. You don't, not necessarily think so, but you'll flesh all that out. I'd like to hear how that works itself out as we move forward.
Thank you, Mr. Sims. Are there further questions from council members? Councilmember Piedmont Smith.
Yeah, I don't actually have a question, but I've been trying to just sneak in just a comment, and that is to give people that state website where they can get statistics about the coronavirus. So it is coronavirus.in.gov. And then if you click on where it says Indiana Novel Coronavirus Map, that's where you get all the data that Ms. Cottle was talking about. So I just wanted to let everybody know about that.
That's that's coronavirus.in.gov. Is that right?
And then click on the map. But
any further questions from members? Councilmember Smith.
Ms. Calendar Anderson, I had heard that there might be a restriction on some deliveries to it used to be Willow Manor. Is that under our purview with the city?
That's not something I've heard about or know about. It's something I can look into, but I don't know about it.
Is that, should I send you a note on that?
Would you please? Yes.
Yeah, I had just heard that there was a restriction on delivery to people's apartments in that facility. And I just heard that yesterday and thought, well, I might ask you. So I'll send you a note on that, and
All right.
I'll have to gather that from my other life, and I'll send it over to you and just.
Yeah, I'll see what I can find out.
Okay. Yeah, I think it was a delivery of actually some medical supplies or incontinence supplies for somebody. So.
Okay.
Okay. Thanks.
Mm-hmm.
Thank you, Mr. Smith. Councilmember Varallo.
Mr. Crowley, I know your team is being careful about this review process, but I wondered when we would anticipate disbursement of funds.
So that will come down to how quickly we can get loan agreements back, processed, and out the door. We have everything on the back end set up. So from a banking wiring perspective, the bank is ready to go. The accounts are the whole process of doing that is all set up. But we have a pretty rigorous internal controls system, which I can speak to very briefly. But the first step of it is to, first of all, make sure we get approval on the loans from both legal and controller. And then once that's done at a high level, then get the loan documents out to the borrower who fills it out and gets it back. So to some extent, the first step, which is probably the most critical, is going to depend on something that's outside of our control, which is how long are they going to take to fill in the documentation, get it out the door. Once it comes back, Jane Cooper Smith, one of the members of the team right now, as we speak, is building a document management system that we've just stood up for this, and hopefully for other things. But the system will issue the documents around and get approvals as quickly as people are able to do it, right? So that's wholly within our control. And we are building a system that is going to be as efficient as it possibly can be, getting out of the business of walking physical documents around, et cetera. So it'll all be electronic, and we'll be able to do that relatively quickly. My original hope was that we were going to get at least orders to the bank to issue monies by the end of the week. And if a borrower finishes that up pretty quickly and we can get everything back in and circulating and make sure the system works, that's still possible. But if the borrowers in this cohort who are approved take longer, then it'll roll into next week.
As this progresses, is it possible that a business or a nonprofit could apply again?
So in terms of if they've been approved for a loan, to get an incremental loan, or if they have been not approved for a loan?
If they've been approved, and we know this is we anticipate that this process is going to go for quite a long time.
Yeah, I think that the answer to that is yes. They'll be reviewed with that context in mind. But if the need is there and the need is justifiable, there's nothing to say that they only had one shot at it. So yes, someone could come back around and say, look, and we know we already have a loan. We need this much more. And if that loan is justifiable, then there's no reason why that can't be sent through.
I see. Thank you.
Any final questions for department heads about the state of the city? Mr. Mayor?
I just wanted to note, you're getting a glimpse of two department heads, but you should be very, very proud of your city government. The department heads all the way down, they're just working their tails off and doing great stuff. And the government that you fund and that you legislate the rules for and oversee that way, you should be very proud of that. And I forgot to mention one thing in regard to some of our employees. We are now offering up to, I think, about 30 hotel rooms that we have retained to help employees in particular areas, police, fire, dispatch, and water treatment. If they feel it's important to stay in a hotel rather than go home in between shifts, we've made that available, and 10 or 12 people are using that to avoid either long distance trips, possible interaction with families and others. So you should know that's happening. That's another thing we're doing to help our employees. And thanks for the time.
Thank you. We appreciate the reports. With that, we'll conclude this portion of the meeting. We'll go now to reports from council committees. Do we have any? Seeing none, we'll go to reports from the public. This is the opportunity for members of the public to weigh in on items that are not already on our agenda. If there is any member of the public who is attending via Zoom who would like to address the council, here's your opportunity. Please either use the raise hand function in Zoom or type into the chat your desire to speak, and Mr. Lucas, our council meeting host, will unmute you and give you a chance to speak. Do we have any takers for public comment?
We do have our first taker. We've got Mr. Jim Shelton. If you give me 1 second.
I will set the timer for 5 minutes.
Should be good to go.
All right.
Good evening,
Mr.
Council.
Shelton, please go ahead.
Good evening. I'm Jim Shelton. I'm with the Chamber of Commerce, but I want to talk to you tonight on behalf of the Court Appointed Special Advocate, or CASA program. CASAs, as you know or probably know, are volunteers who work with children who are in the justice system because they've been abused or neglected. And the COVID-19 is also impacting the juvenile justice system. We're having more cases coming every week. You can imagine the stress on folks whose children are home. We've got parents reverting to the use of drugs, or we've got parents physically abusing their children. So we're having new cases every week. And right now we've got 30 children we do not have a CASA to assign to. So we need people to step up and volunteer. It's a very rewarding program. The first thing you would do, you would be trained by the CASA staff professionals to prepare you to work on this kind of program. You would be working virtually. The CASA program is very, very careful about our volunteers. So there's no more face-to-face interactions with anybody going on. You use things like Zoom or FaceTime to interact with the children or the service providers. I have a CFT, a child family team meeting tomorrow evening or tomorrow afternoon at 1 that we will be doing via Zoom. So you're not endangered by being exposed to the virus by virtue of being a CASA. The first step would be you would go to monroecountycasa.org or call 333-2272 and get any concerns you might have answered. There's an application you could download and fill out, and then you would have a training of some 30 hours. The next one of which is scheduled for 1 June. We hope we can still do that. There's a good chance it will be a Zoom kind of training. And then you would be sworn in by Judge Galvin and be assigned a case. You would work the case along with a CASA staff member. So you're not out there by yourself. You are not in charge of trying to fix things. That's the court's job. Your job is to help the court know what's going on. So I invite people who have been thinking about this, and nationally we hear people think about it for about 2 years before they actually do it. To think about actually doing it now. We need people to volunteer in this time, and keep up on the website with when the training is going to actually happen. And I appreciate the opportunity to bring this to your attention. Thank you.
Thank you, Mr. Shelton, an important message. Further members of the public who wish to speak? Mr. Lucas?
Yes, we've got, Ms. Jennifer Pearl, if I can, there you go.
Hi.
Ms. Pearl, please go ahead.
Thank you so much. And I'm Jennifer Pearl. I'm the president of the Bloomington Economic Development Corporation. I'm working with the ES&R team, and it's been a real pleasure to do so. What I wanted to actually comment on is something broader than that. Our team was putting together a list of all of the workers in our community today, just that, you know, we have a great deal of appreciation for. And I just wanted to take a moment to give a shout out to this broad coalition of people that we've been hearing about and seeing, you know, this last month or more. And just to rattle off some of the categories of people, it's, you know, the healthcare workers, not just the nurses and doctors, but the receptionists, the cooks, the cleaning staff, the technicians, public health officials, emergency responders, public safety workers, frontline workers, anybody from a grocery store to gas stations and home supply stores. There's funerary and mortuary individuals, restaurant and hospitality teams, transit personnel, government employees at all levels, social service and philanthropic partners, educators, and not just the teachers, but the families who are now doing e-learning, as well as even cooks and janitors who've done a huge pivot within the schools that we've gotten to hear about from the superintendents, utilities and infrastructure crews, individuals working in the trades that are keeping our infrastructure going, from heating and cooling to other things. We have our manufacturers who are on the front lines of creating PPEs, as well as producing medical supplies, and there's so many of those in our community. The financial and legal teams that are helping us all navigate these times, and also a huge thank you to the families of all these essential workers, because they've borne a greater burden in taking on more responsibilities while also worrying about their loved ones who are on the front lines. And finally, we just wanted to thank our neighbors because everyone is trying to do their part. They're donating, they're sewing, they're staying home. And we just wanted to express our appreciation for everyone. Thank you.
Thank you, Ms. Pearl. Mr. Lucas, further members of the public who wish to comment?
Yes, just one second. I believe we've got Miss Kelly Clark here, although I don't see that she's connected to the audio yet.
Ms. Clark, can you speak for a second so we can hear if you're...
There we go.
There you go. Please go ahead. Ms. Clark, go ahead.
Oh, sorry. I think that my audio must be behind from you guys.
You're doing great. Go ahead and speak.
Okay, I just wanted to hop on and say real quickly, for those of you who don't know who I am, I'm the...
I don't see that she's connected to the...
Could we have you mute your audio so that you don't feedback? I don't know if it's possible. Please go ahead.
Hi.
Ms. Clark, go ahead.
I'm talking. I think that my audio must be behind from you guys.
You're doing great. Go ahead and speak.
Okay, I just wanted to hop on and say real quickly, I'm the...
Could we have you mute your audio?
I sent her a message to turn down her volume. Give it a second.
Can you turn her up now? See if that will work.
She's apologizing. Hi, Kelly. If you can hear us, go ahead. If you'd, I can send her some.
So I am going to go ahead and just talk. I'm sorry, I can't hear any of you. But I just wanted to say quickly, thank you to Beverly Callender Anderson and to Chief Moore and to our council meeting host here who is trying to guide my very Zoom not friendly self through this. But I'm the person leading the Bloomington Fabric Mask Drive, and they have gotten me access to Allison Jukebox in this past week. They, Chief Moore helped set up free washing of our masks through Bloomington Cleaners. He sent over Max, one of his, I believe, deputy chiefs, with a whiteboard like the size of my couch the other day. They've just really done everything that they possibly can to bend over backwards and help us and make our work easier. And I'm sorry that I probably look very silly on all of this, but I just really wanted to hop on and say thank you live while I can.
Thank you very much. We really appreciate it. Mr. Lucas, any other public comment?
Yes, give me a second. We've got Mr. Ethan Shimon, who should be good to go.
All right. Thank you, Council. Can everybody hear me?
Yes.
Yes, go ahead.
Thank you. So I'm a student here at Indiana University. Obviously, I'm back home right now with everything going on. I just had a couple of my roommates bring up something that I wanted to share, something that maybe somebody can comment on at maybe even a later date. I know there's a lot of students who live in off-campus housing and definitely are using a lot of the like Bloomington city utilities, things like, trash, stuff like that. And they're probably not suspended any of those services, but definitely not utilizing those services, but still paying for them. So is there a way that either, there's a reimbursement or something along those sorts in terms of city provided utilities that are still ongoing, or maybe even a divergence of funds and to be used in a better way so that it just doesn't sit there and collect when those utilities aren't being utilized?
We don't, it's not a back and forth, Mr. Sheeman. We will take your comment under advisement. So if you have any other things to say.
That's all. Thank you.
We appreciate your comments and we will take it under advisement. Thank you. Are there further members of the public who wish to speak on items that are not on the agenda? Mr. Lucas?
I don't see anyone else, but give me just a moment.
If you're a member of the public who would like to speak on an item that's not on the agenda, here's your opportunity. Please use the raise hand function in Zoom or type into the chat of this meeting. We'll wait 10 more seconds. Seeing no further public comment, we will resume the rest of the meeting. We thank everyone for their comments, which we'll take under advisement. We now go to appointments to boards and commissions. Do any members have appointments? Seeing none, we'll move to legislation for first reading and resolutions. Madam Parliamentarian.
Yes, Mr. President, I move that Ordinance 2006 be introduced and read by the clerk by title and synopsis only.
Second.
Motion and a second. We cannot do voice votes here, so will the clerk please call the roll on whether or not to introduce Ordinance 2006? Madam Clerk.
Yes, I apologize. I was muted. Councilmember Rallo?
Yes.
Scambaluri?
Yes.
Rosenbarger?
Yes.
Sims?
Yes.
Bolin?
Yes.
Piedmont Smith?
Yes.
Flaherty?
Yes.
Smith?
Yes.
And Sandberg?
Yes.
Will the clerk please read Ordinance 2006, title and synopsis?
Yes, Ordinance 2006 to repeal and replace the official zoning map within Title 20 of the Bloomington Municipal Code entitled Unified Development Ordinance. The synopsis is as follows. This ordinance repeals the 2007 official zoning map as referenced within Title 20 of the Bloomington Municipal Code and adopts a 2020 official zoning map, conversion map. The 2020 official zoning map will consist of a conversion zoning map. The conversion zoning map will only replace the names of the 2007 official zoning map existing districts with the new district names as detailed in Table 2. 1. Summary of zoning districts of the newly adopted UDO. The effective date of the adopted UDO will be the same date as the effective date of this conversion zoning map. Following adoption of the official zoning map, the Planning Commission and Common Council will consider a more comprehensive update to zoning district boundaries and may consider other changes to the UDO.
Thank you, Madam Clerk. Will the parliamentarian continue?
Yes, Mr. President, I move that Ordinance 2007 be introduced by the clerk and read by title and synopsis only.
Second.
Second.
Can we have a voice vote on, or a roll call vote rather, on whether to introduce Ordinance 2007, Madam Clerk?
Councilmember Scambaluri?
Yes.
Rosenbarger?
Yes.
Sims,
Yes.
Wolin,
Yes.
Piedmont Smith, Piedmont Smith,
Yes.
Flaherty. Lost him. Okay. Smith,
Yes.
Sandberg,
Yes.
and Rollo.
Yes.
Okay, and I see that Mr.
Can we get
Flaherty
Mr.
is
Flaherty's vote?
back.
Sorry, I had to
Yes,
step
Mr.
out of the room and didn't hear the motion. I'm happy to vote on
The
it.
motion to introduce ordinance 2007.
Yes.
Will the clerk please read title and synopsis of ordinance 2007?
Yes. Ordinance 2007 to amend Title 20 of the Bloomington Municipal Code entitled Unified Development Ordinance. The synopsis is as follows. This ordinance amends Title 20 of the Bloomington Municipal Code containing the zoning ordinance entitled Unified Development Ordinance. Adoption of a new official zoning map in Ordinance 2006 establishes the effective date of the UDO and the textual amendments contained in this ordinance. These text amendments are few in number and are intended to make non-substantive corrections to the UDO. None of the amendments change policy.
Thank you. With that, we now go to legislation for a second reading and resolutions. Madam Parliamentarian.
Yes, first I'd like to move that the council introduce and consider ordinance 2006 for adoption at the same meeting and on the same night it is introduced.
Second.
A motion and a second. Is this debatable, Mr. Sherman? Mr. Lucas?
Yes, it is debatable.
I believe so, yes.
Does anyone have any discussion on on the motion?
I just want to explain that according to our local municipal code, we normally cannot introduce and also take a final vote on the same ordinance on the same night.
Well, we just lost your audio, Ms. Piedmont Smith. Stop. Mute her, would you please? She's muted herself. Ms. Piedmont Smith, we lost you after a certain point.
Oh,
can you repeat
I'm sorry.
your second sentence? There, you're back. Can you please finish your explanation, restate your explanation?
Okay. Well, so I just wanted to explain why we have this extra motion on the table. And that is because under our municipal code, we cannot normally introduce and have a vote on an ordinance on the same night. And so therefore this motion is necessary and it must be approved unanimously by all council members. And if it is approved, then the ordinance itself must be approved by at least 2/3 of the council in order to pass.
I have a question if nobody else does. I understand that statute actually, first of all, I think that our code is, as Ms. Piedmont Smith has described it, because of statute, but that statute also allows for this particular kind of ordinance, a planning ordinance, to be considered in one night without exception with a majority. Mr. Lucas, can you, or Mr. Sherman, can one of you expound upon this?
I can try. Yes, state law typically requires 2 readings and would also require unanimous consent, like Councilmember Piedmont Smith just moved to take something up in the same night it's introduced for final vote. So yes, that's our local code mirrors state law in that respect. For these particular ordinances, Ordinance 2006 and 2007, state law does allow for action at one meeting. The reason for the motion is purely because our local code doesn't include that same allowance. Because our local code doesn't make an exception for these types of ordinances when state law does, that's the reason for the motion.
Okay, thank you. Any other questions on the motion?
Call the question.
If not,
second.
All right, will the clerk please call the roll on the motion?
Yes. Councilmember Rosenbarger?
Yes.
Sims?
Yes.
Volan?
Yes.
Piedmont Smith?
Yes.
Flaherty?
Yes.
Smith?
Yes.
Sandberg?
Yes.
Rallo?
Yes.
And Scambalori?
Yes.
The ayes have it. We will proceed under those constraints.
Mr.
Who is
President, I
here to?
move that
Oh, yes,
ordinance
go ahead.
2006 be adopted.
Second.
We have a motion and a second. Will the clerk please call the roll? Oh, sorry, we don't need that. We go, motion seconds enough to begin the discussion. I see Terry Porter here from the Department of Planning and Transportation. Is she presenting or is someone else presenting?
I believe we've got Scott Robinson here, who I think is joining us just via audio. So Scott, if you can hear us and you're ready, go ahead.
Yes, can everybody hear me okay?
Yes, you're coming through loud and clear.
Yes.
I apologize, I have some poor connection, so I had to call in tonight, but I want to appreciate Council for taking the time to hear these two ordinances this evening under these unique circumstances. I really don't have much of a staff report. Pretty much what was included in the council packet is very detailed, and what these two ordinances are covering. It's something that we've talked about from the very beginning with the Unified Development Ordinance update process, that once we got through getting the rules adopted, which we did back in December and January with the Plan Commission, this next step is simply just updating the zoning map. And again, we're doing that because the zoning districts simply changed their names, and so we need to reflect those name changes on the zoning map. None of the boundaries are changing, it's just the names. The second ordinance, 2007, staff went through, after all the amendments that were considered both at the Plan Commission and City Council level, found a few little minor corrections, and that's what the second ordinance 2007 is addressing, is just doing some cleanup to the UDO. So I'd be happy to answer any questions. Again, I apologize that I'm calling in by phone. So with that, again, I wanted to thank everybody for taking the opportunity to bring this for consideration tonight, and again for under consideration under one hearing. I do appreciate that. Thank you.
Thank you, Mr. Robinson. We appreciate it. Let's just stick to 2006, the question of the maps first. We're going to have a vote on 2007 in short order. Are there any questions from council members on Ordinance 2006? I see no hands raised. Mr. Robinson, I will ask one question. When do you foresee, so again, 2006 simply renames every, or renames the zoning type to reflect the new types that are in the new UDO, which we'll consider next. When do you foresee the changes to the map, the substantive changes coming forward?
Councilmember Volan, that's a good question. You know, I think if you would ask me that, I think that was discussed during our council lunch meeting about a month ago. I might have had a different answer, but given the current situation that we're in right now, I think there's a couple of things to be mindful of. One, the city's just now initiating a kickoff process for the Bloomington Hospital site. That's a focus area that there's one area we anticipate a need to change the zoning there, but that's a process that we want to kick off and get feedback from the community on what are the right types of things we want to see happen there. So we would like to see that wrap up before we'd come back to you to make those kind of recommendations on that particular area of the community on what to rezone. So again, with the circumstances that we're in right now, it's public engagement and those sort of things we're still navigating those timelines and processes. So once that starts running its course, our team will start picking up where that leaves off and initiate a separate process about updating the zoning map. I would anticipate that to take about a year, but again, kind of depends on what happens the next month or two on the current status of the stay-at-home order and other things that we're looking at.
But you're saying then that it's possible that the rezoning that is necessary, that will follow tonight's discussions, may not happen in 2020 at this point.
I think that's a fair expectation. Again, you know, we want to make sure we let that process run with the hospital before we're looking at rezoning other areas of the community. I know there's some large areas in the southwest area of the community that were discussed about. And, you know, we would kick off a public process to get input from the community about other areas. But again, we're kind of looking at those focus areas that were identified in the comprehensive plan. And the hospital site is one of those areas that we're looking at, as well as the southwest portion of the community. There really isn't an intent by us to, you know, look at other areas within the built-out environment to rezone. But again, we would be listening to that feedback when we kick that process off. So short answer, I think it would be highly unlikely we get this done before the end of this year, considering we have to have a public process, considering we have to take it to Plan Commission and get on your agenda before the end of the year. I think that would be a pretty aggressive schedule to accomplish by that time.
That is understandable. Thank you, Mr. Robinson. Any further questions on Ordinance 2006?
Can I make a comment?
No, we're on questions still. And Ms. Porter has appeared too, in case you have questions for her as well.
I have a question then.
All right, what's the question?
The question is, I think I understand it, will the public opportunity for the public to weigh in, that will come before you will develop the changes in the ordinance or in the zoning, so they have time to incorporate those into the process.
Yes, Councilmember Smith, that's correct. So with the hospital process, there will be a public engagement opportunity and multiple opportunities for that. And so once that wraps up, we would use that to base our recommendations on. And then with our planning process, we would have a similar opportunity to specifically talk about the map, some public engagement, and then we'd have to bring it to Plan Commission and then subsequently City Council. So there would be ample opportunity for members of the community to participate in both of those.
Thank you, Mr. Robinson. And how would they be publicized, the opportunity for public comment?
Well, the hospital site, we're still discussing that internally and how to outreach with the community. You know, we're certainly looking at online forums and other things. So that public process hasn't kicked off yet, but that's stuff that we're working with our consultants with right now on how to engage the community. So we're exploring all venues and opportunities with that. With the mapping process, it'd be very similar to what we did with the Unified Development Ordinance update. I do believe because of the notification rules that we would have to mail out postcards to every property owner in the community. So that's another kind of benchmark to keep in mind, that, you know, oftentimes people aren't aware of what's going on through, you know, typical outreach that we do, that at the very least they would get a notice in the mail with that. I'd have to double check on the requirements, but generally when we're looking at zoning map, there's a pretty high threshold we have to meet on that notification process.
Thank you, Mr. Robinson.
Thank you, Mr. Smith. Are there further questions on Ordinance 2006? Seeing no further questions, we're going to go to the public now.
Nicole.
Yeah, Madam Clerk, you have a statement for us?
Just a point of order. You haven't actually read the ordinance yet for second reading.
Oh. Sorry, we're in strange days here.
I move that
well,
Ordinance 20.
But we did just have it read in first reading. I think, you know, since we're doing it in one night, I think it's okay. We heard it in first reading seconds ago.
It was moved for approval. It was just not read again.
Yes.
It was moved for adoption. It wasn't moved, or it just wasn't read for title and synopsis. I think Stephen wanted to say something.
Given that this is tied to the effective date of the entire UDO, I think it would be worth going back and making sure that we read it for second reading.
All right, we need a motion from the parliamentarian.
I move Ordinance 2006 be read. Introduced and read by title and synopsis only by the city clerk.
Thank you. Or second.
We need a roll call vote.
Yeah. Okay. Ordinance 2006 to repeal and replace the official zoning.
We need a vote first.
We need a roll call vote before you start reading it.
And see, I just went right into it too. Sorry, everybody.
All of us.
It's easy to get flustered.
Well, we're just off track, I think. I'm still talking. Okay. Councilmember Sims.
Yes.
Thank you. Wolin.
Yes.
Piedmont Smith.
Whoever's pouring something should mute themselves.
Yes.
Flaherty.
Yes.
Smith.
Yes.
Sandberg.
Yes.
Rallo.
Yes.
Scambaluri.
Yes.
And Rosenbarger.
Yes.
I heard a yes. The ayes have it. Will the clerk please read?
Oh my God. Okay, Ordinance 2006 to repeal and replace the official zoning map within Title 20 of the Bloomington Municipal Code entitled Unified Development Ordinance. The synopsis is, this ordinance repeals the 2007 official zoning map as referenced within Title 20 of the Bloomington Municipal Code and adopts the 2020 official zoning map. The 2020 official zoning map will consist of a conversion zoning map. The conversion zoning map will only replace the names of the 2007 official zoning map districts with new district names as detailed in Table 2.1, Summary of Zoning Districts of the newly adopted UDO. The effective date of the adopted UDO will be the same as the effective date of this conversion zoning map. Following adoption of the official zoning map, the Planning Commission and Common Council will consider a more comprehensive update to zoning district boundaries and may consider other changes to the UDO.
Thank you. Madam Parliamentarian, would you please make the second motion?
Again.
Yes, just in case.
I move Ordinance 2006 be adopted.
Second.
Thank you. We've already heard the comments from Mr. Robinson. I ask everyone to just take those and the questions. Are there any further questions on Ordinance 2006? Seeing none, we will now go to the public for comment on Ordinance 2006. Mr. Lucas, is there anyone who is queued up to make comment? While he looks that up, I will simply point out, if you want to comment on Ordinance 2006, please use the raise hand function in Zoom or type into the chat for this meeting. Mr. Lucas, do you see anybody?
Not at the moment, no.
We'll wait a few more seconds for people to either type into the chat or to use the raise hand function in Zoom. Public comment. Another 10 seconds. Mr. Lucas, anybody?
No.
All right, we'll go back to the council.
Memo says a broad policy supporting, leeway for the administration. So I think I said in the work session that, your legislative body and our administration work together. We're kind of two heads of the same body, and we need to know what each other is doing. And so we did that to be very transparent about the statute and what the powers would be.
And just to quickly follow up, I'll have to review the definition section of that statute. It specifies a political subdivision is the entity that has that power. And I believe your response, Ms. Guthrie, during the work session was that, and perhaps Council Attorney Sherman had weighed in as well, that it was not clear whether that meant the legislative or executive body.
Right.
Am I misremembering that, or is that sort of the interpretation?
Yeah, no, that's what I meant by saying it's you and it's us, and what is the city? We're both in there. So.
Okay, thank you. I can just continue or follow up with my comment since we were on those, if that's appropriate, but I'll leave it to.
Yeah, just hang on for a sec. Do we have any further comments from any fellow council members? Councilmember Flaherty, please proceed.
Sure. Yeah, I think I do want to explore a couple of the topics that I brought up. It's just out of an abundance of caution and a respect for the role we are elected to play. And I grant certainly that these are extraordinary times that do call for changes in the way we do some things. But just out of, again, an abundance of caution, I do want to explore the few topics that were brought up related to oversight, as long as those were not unduly burdensome, to clarify when and how this would be used, I think would be useful and help provide some level of public oversight from elected officials, which is really what the vision is for how our government should function. So I just wanted to mention that with that kind of caveat, I also certainly support this and support the intent, and look forward to exploring those few things in the next couple of days. Thank you.
Thank you. Any further comments from my fellow colleagues? Thank you. I will, looks like I'll finish this up. My comment is that I think it's clear, and I think we all understand that this is temporary during this emergency status. In my view, this board, this council has the ultimate accountability. And I think there was an analogy made earlier by one of my colleagues about doing something to see if it works. And I agree with that. And I will say many of the other comments have had merit and should be looked into. So not intending to discount any of that. But one of the big or the main things with this particular ordinance, I think, is to add flexibility so that we can take care of things or quick, fast, in a hurry, if I could use another bit of terminology here. And I am comfortable that there will be, you all or the staff will respond to us. There will be regular updates. There will be documentation, which I think is equally important. And I kind of want to caution folks to already have a roadmap in a place that we haven't ever traveled. I think we will be creating that roadmap as we move forward. But I thank everyone for their comments. I think they have merit, and I'm sure they will be looked into further. Any further final comments from any of my council member colleagues?
Move to pass.
Second.
Thank you. Been moved to pass. Or Ordinance 20-09. Mr. Lucas, I have it on the gallery screen so I can see everyone. So do I call them, being this is a committee meeting, or does the clerk?
You can just go down the line and ask members what their recommendation is.
Okay, thank you very much. Councilmember Smith.
Yes.
Councilmember Rollo.
Yes.
Councilmember Scambolari.
Yes.
Councilmember Flaherty.
Yes.
Councilmember Sandberg.
Yes.
Councilmember Piedmont Smith. Councilmember Piedmont Smith.
Yes.
Thank you. Councilmember Rosenbarger.
Yes.
Councilmember Volan.
Yes.
And Councilmember Sims votes yes. We have a do pass recommendation of 9-0. Okay, with that, I think our business for this evening has concluded. Is there a motion to adjourn?
Second.
Okay, it's been moved and second. I think we are adjourned.
Good night, everybody.
Good night.
Thanks,
Thank you
everyone.
all.
Thank you.
Thank you.
Thank you.
Good night, everybody.
you.